This morning, fentanyl test strips and OD reversal drugs are being taken to Unwinded. This after the highly addictive substance that's responsible for the deaths of thousands each year in the United States has found its way to our shores. 12 people were hospitalised after using what was thought to be cocaine, but further testing revealed it was in fact fentanyl. Let's talk now to Sarah Helm, who's with the New Zealand Drug Foundation. She's with us this morning. Good morning.
Good morning.
Tell me, so what's happening today? You're going to be taking some test strips and some OD reversal medication to Unwinded, is that right?
Yeah, that's right. So one of the main recommendations we have for people who have white powder and are Unwinded based, but actually Wellington based, is to use a fentanyl test strip to ascertain whether or not your drug is what you think it is. So we're cutting some of those over. Also, there's an opioid overdose reversal drug called naloxone. It's very effective at resuscitating people, and it's the reason why those dozen people are still alive right now. We have a shortage of it in New Zealand. We're carting the 45 boxes we have over to the Unwinded today with the help of the police.
So these are your boxes, are they, of naloxone? How did you get your hands on them?
Yeah, look, New Zealand's quite underprepared for this situation, partly because of our drug laws and partly because of access to harm reduction services and overdose interventions like naloxone. We fundraise to purchase those 45 boxes, and we will be really looking to amplify the message about the need to both change the regulations and the funding around naloxone in New Zealand and get more of it into the country.
So this medication that's helped save lives already in Unwinded, you have had to fundraise for it?
Yeah, well, there's some, luckily the ambulance services over there have it, but it's not a widespread available medication, so we're very, very lucky. It's a miracle, literally, that those dozen people are still alive, and I'm really hoping that this is the extent of the issue over there. It was both people who had purchased cocaine and methamphetamine, and we live in considerable worry about the prospect of a fentanyl outbreak in New Zealand, of it adulterating our illicit drug supply because of the harm that it does create. Yeah. We're seeing in the States something like 80,000 people.
No, crazy. So what is your understanding of the drug itself that's done the harm to these 12 people? Did these 12 people know each other, or had they each bought drugs separately from the same person, do you suspect?
No, what we do know is there's different groups of people involved. We don't know about the supply chain at this point of time. Really, I think the primary concern is trying to work out how widespread it is and try and stop it being distributed further, and to prevent further fatalities.
Would you, based on overseas experience, would you say this is likely to have been a drug that was cut into the, cocaine or methamphetamine or whatever here, or would it have come in like that from overseas?
Most likely come in like that from overseas. It's quite hard to access in New Zealand. It's used in hospital settings only, and it's quite fantastically regulated here in that regard, unlike in the States. But what we also have instead, so the test sort of demonstrated that it was probably almost entirely fentanyl, this drug, although we're doing some confirming testing this week. Look, the other real worry here is our drug laws. So what we've seen in the States is the overdoses really amplified by a mess of a drug law that we have quite similarly here in New Zealand, and outdated thinking, war on drug thinking. And so you've seen, the deaths continue to climb, actually. We badly need to reconsider our drug laws and our approach to resourcing, harm reduction and overdose prevention, and we really need to sort of reorient our way of addressing drug issues. So what we do have, which is great, is legalised drug checking, and that is just a miracle that we have that in place now. And we also have an early warning system that is what has been, we're lucky that we've picked this information up, and it's only because we've got that under-resourced, not supported by the wider drug law. So at the moment, trying to convince people to cooperate or even try and find the community of people that are impacted on this, because making it illegal means that these people go to ground, and it's really hard for us to find and prevent.
No, it's almost a perfect cocktail, to use a probably inappropriate turn of phrase, and a nasty cocktail of factors that mean that this problem is only going to get worse before it gets better. Thank you very much for your time this morning, Sarah. We will leave you to do the good work that you're doing. Executive Director of the New Zealand Drug Foundation, Sarah Helm.